Stop ignoring burning feet if you have diabetes. If your feet burn at night, tingle like tiny needles, feel numb when you walk, itch without a clear reason, or develop dark marks that do not seem to heal the way they should, your body may be warning you that high blood sugar is starting to affect your nerves, your blood vessels, and the circulation going all the way down to your toes. And here is the part most people are never told clearly. The problem may not begin in the feet at all. Many people rub creams on the skin, soak their feet in warm water, or blame old shoes, dry skin, aging, or poor circulation, while the real pressure is coming from inside the body. High blood sugar can irritate nerves. It can damage small blood vessels. It can reduce blood flow. It can make healing slower. And over time, that burning, tingling, numb feeling can become more than just discomfort. It can become a warning sign that your nerves are under stress. Now let me be very clear from the beginning. No tea cures diabetic neuropathy. No drink repairs nerve damage overnight. And if you have an open sore, a black spot, swelling, pus, bad smell, severe pain, sudden color change, or a wound on your foot that is not healing, you need medical care quickly. Do not try to treat that with tea at home. But the right teas, used the right way, may help support the things your feet desperately depend on: steadier blood sugar, calmer inflammation, better circulation, better sleep, and less oxidative stress inside the body. And when you support those areas consistently, you may help give your nerves and blood vessels a better environment. I am Dr. Arthur Mark, and in this video, I am going to walk you through 5 teas that may help support burning feet, tingling, numbness, and blood sugar control in people with diabetes. Before I show you the first one, do me a quick favor. If you have diabetes, burning feet, numb toes, or nerve pain, subscribe to this channel right now, because these small symptoms are exactly the kind of warning signs people ignore until they become serious. My goal is to help you understand what your body is telling you before it gets worse. And leave me a comment below. Do your feet burn more at night, when you walk, or when you are resting? I read those comments, and they help me know what to explain next. Now, before we talk about the teas, you need to understand why diabetic feet burn in the first place. Your nerves are like electrical wires. They carry messages from your feet to your brain, and from your brain back to your feet. When blood sugar stays high for months or years, those nerves can become irritated, inflamed, and damaged. That is one reason people feel burning, stabbing, pins and needles, crawling sensations, itching, or numbness. But nerves are only one part of the story. Your feet also need healthy blood flow. The tiniest blood vessels bring oxygen and nutrients to the nerves and skin. Diabetes can damage those small blood vessels too. So now you have 2 problems happening together. The nerves are irritated, and the blood supply that should protect them is weaker than it should be. That is why this problem can feel so strange. Some people say their feet feel hot, but when they touch them, the skin does not feel hot. Some say the feet feel numb, but at the same time they burn. Some feel like ants are crawling under the skin. Some feel sharp pain when the bedsheet touches the toes. Others get itching, dark marks, dry skin, or small cuts that heal slowly. And the mistake is thinking this is only a foot problem. It is often a blood sugar problem, a circulation problem, and an inflammation problem. That is where these teas come in. They are not magic, they are support. They may help support the internal environment that your nerves and blood vessels need. The first tea is green tea. Green tea is one of the best places to start because it works on one of the biggest drivers of diabetic nerve stress: oxidative damage. Oxidative stress is what happens when the body is under too much internal pressure from high blood sugar, inflammation, poor diet, and damaged blood vessels. Think of it like rust forming inside the system. Over time, that stress can irritate nerves and make circulation worse. Green tea contains powerful plant compounds called catechins, especially EGCG. These compounds may help support healthier inflammation balance, blood vessel function, and blood sugar metabolism. That matters because the nerves in your feet cannot heal or function well if the blood vessels feeding them are constantly under stress. Green tea may also support insulin sensitivity. That means the body may respond to insulin more efficiently, so blood sugar does not stay elevated as long after meals. And when blood sugar becomes steadier, the nerves are exposed to less daily irritation. Let me make this practical. If you are someone who wakes up with burning feet at night, then drinks sweet tea, soda, juice, or a sugary coffee in the morning, you may be feeding the very blood sugar swings that keep the nerve irritation going. Replacing one sugary drink with plain green tea can be a simple first move. Start with 1 cup in the morning or early afternoon. Do not load it with sugar. If you need flavor, use lemon or a small amount of cinnamon. Let it steep gently, not too long, because oversteeping can make it bitter. And if caffeine bothers you, choose decaffeinated green tea. Picture someone like David, 64, who told himself his burning feet were just age. Every night his toes felt hot, and every morning he started with a sweet drink. He did not change everything at once. He simply replaced that sweet drink with green tea and started paying closer attention to his blood sugar after meals. That one change did not cure his feet, but it removed a daily sugar hit and gave his body a better signal. That is how progress often begins, not with perfection, with one repeated swap. The second tea is ginger tea. Ginger tea is important because many people with diabetic foot discomfort also describe their legs and feet as heavy, cold, tight, or poorly circulating. Ginger has natural compounds called gingerols that may help support circulation and inflammation balance. And when you are dealing with burning, tingling, or numbness, circulation matters. Your feet are far from your heart. Blood has to travel all the way down and all the way back up. If the blood vessels are stiff, inflamed, or damaged by diabetes, the nerves in the feet may not get the oxygen and nutrients they need. That can make symptoms feel worse, especially at night or after sitting too long. Ginger tea may help support warmth and blood flow. It may also help calm inflammation, which is important because irritated nerves often exist in an inflamed environment. Again, this is not a cure, but it may be a helpful support. The way to use it is simple. Slice fresh ginger, add it to hot water, and let it steep for 10 minutes. You can add lemon, you can add a little cinnamon, but do not turn it into a sweet drink with sugar or honey if your blood sugar is already high. That defeats the purpose. Ginger tea can be useful after meals, especially if you feel bloated, heavy, or sluggish. Some people like it in the evening, but if it makes you feel too warm or affects your stomach, use it earlier in the day. Imagine a woman like Linda, 70, who says her feet burn at night but feel cold during the day. She keeps rubbing them but never thinks about circulation. She starts drinking ginger tea after dinner instead of a sweet dessert drink. Over time, she also begins checking her blood sugar, reducing processed foods, and walking gently after meals when her doctor says it is safe. The tea is not the whole solution, but it becomes part of a better pattern. That is the key. These teas work best when they replace something that was making the problem worse. The third tea is cinnamon tea. Now this one needs careful explanation because cinnamon is popular online, and many people exaggerate what it can do. Cinnamon does not cure diabetes. Cinnamon does not replace medication. And if you sprinkle cinnamon on a sugary dessert, that does not make the dessert healthy. But cinnamon contains plant compounds that may help support insulin sensitivity and blood sugar control when it is used as part of an overall healthy pattern. Why does this matter for burning feet? Because nerve irritation in diabetes is strongly connected to blood sugar exposure over time. The more often your blood sugar spikes high and stays high, the more stress your nerves and blood vessels experience. Anything that safely supports steadier blood sugar may help support the environment around those nerves. Cinnamon tea can be a useful replacement for sugary drinks. It gives a naturally sweet flavor without adding sugar. That helps people who crave something warm and comforting at night, but do not want to spike their glucose before bed. To make it, use a cinnamon stick or a small amount of cinnamon powder in hot water. Let it steep. Add lemon if you like. Keep it unsweetened. If you use cinnamon daily, choose Ceylon cinnamon when possible, because very high amounts of common cassia cinnamon may not be ideal for some people, especially those with liver concerns or those taking certain medications. And if you are on diabetes medication, always monitor your blood sugar. When you improve diet, drinks, and meal timing, your numbers can change. That is a good reason to work with your clinician, not to guess. Think about someone like Robert, 68, who says his feet tingle every night and he always wants something sweet after dinner. Instead of cookies and sweet tea, he starts using cinnamon tea. The warm flavor gives him comfort, but without the same sugar load. Over a few weeks, his evenings become calmer. his glucose readings become less dramatic, and the foot symptoms are no longer being fueled by the same nightly spike. That is the kind of practical change that matters. The fourth tea is turmeric tea. Turmeric is known for its bright golden color, and its key compound is curcumin. Curcumin has been studied for its role in inflammation and oxidative stress, and when we talk about diabetic nerve discomfort, inflammation matters a lot. High blood sugar creates chemical stress. That stress can damage small blood vessels and irritate nerves. Over time, the body becomes like a room with the alarm constantly ringing. Turmeric may help support a calmer inflammatory environment. Now, turmeric is not absorbed very well on its own. That is why many people combine it with a tiny pinch of black pepper, because black pepper contains piperine, which can increase curcumin absorption. But you must be careful. If you take blood thinners, have gallbladder disease, kidney stones, stomach ulcers, or are scheduled for surgery, talk to your doctor before using turmeric regularly in higher amounts. For a simple turmeric tea, use warm water, a small amount of turmeric, a pinch of black pepper, and maybe ginger or cinnamon. Some people add unsweetened milk or a low-sugar milk option, but do not add sugar. The goal is to support inflammation balance, not create a sweet drink. Turmeric tea may be especially useful for people who describe their feet as burning, aching, and inflamed after a long day. It may help support the body's recovery environment, especially when combined with better blood sugar control, better sleep, and less processed food. Picture someone like Maria, 72, whose feet feel like they are buzzing and burning when she lies down at night. She keeps thinking it is only dry skin. But she also has high blood sugar, poor sleep, and lots of processed food in the evening. She begins using turmeric ginger tea at night instead of snacking, and she starts checking her glucose more carefully. The tea becomes a signal that the eating window is done. That alone can reduce nighttime sugar spikes for some people. Again, the tea is not magic. The pattern is powerful. The fifth tea is chamomile tea, and I save this one because many people underestimate how much sleep and stress affect diabetic nerve symptoms. If your blood sugar is high, your sleep is poor, and your stress hormones are elevated, your body has a harder time repairing itself. Poor sleep can make blood sugar harder to control. Stress can raise glucose, and when you are tired, pain feels louder. Burning feet at night can also make sleep worse, and then poor sleep makes the next day's blood sugar worse. It becomes a cycle. Chamomile tea may help support relaxation and better sleep quality. It is caffeine-free, gentle for many people, and can be a useful nighttime ritual. It may also help people stop late-night snacking, which is a major problem for blood sugar. Late-night snacks are not always about hunger. Sometimes they are about stress, habit, boredom, or discomfort. If you replace that snack with chamomile tea, you may reduce the glucose load your body has to manage overnight. This matters because many people with diabetes wake up with high fasting blood sugar and do not understand why. Sometimes the liver releases glucose overnight. Sometimes the previous evening meal was too heavy. Sometimes sleep and stress hormones are involved. Chamomile tea does not solve all of that, but it may help support the bedtime routine that blood sugar control often needs. Use it 30 to 60 minutes before bed. Keep it unsweetened. Sit down, drink it slowly, and use that time to check your feet. Look at the skin. Look between the toes. Check for cuts, blisters, dark marks, swelling, redness, or wounds. Many diabetic foot problems get worse because people cannot feel the injury early. That one habit, chamomile tea plus foot inspection, can be more valuable than people realize. Imagine someone like James, 73, whose toes are numb. He does not always feel small cuts. Every night he used to snack, watch television, and go to bed without checking his feet. Now he drinks chamomile tea, checks both feet with a small mirror, and notices problems earlier. That is not just a tea habit, that is foot protection. Now let us bring all 5 teas together. Green tea may help support blood sugar metabolism, inflammation balance, and oxidative stress. Ginger tea may help support circulation, warmth, digestion, and inflammation balance. Cinnamon tea may help support insulin sensitivity and reduce the need for sweet drinks. Turmeric tea may help support a calmer inflammatory environment around nerves and blood vessels. Chamomile tea may help support sleep, stress control, late-night cravings, and a nightly foot check routine. But here is the mistake I do not want you to make. Do not drink these teas and keep doing the exact things that are worsening your feet. Do not drink green tea in the morning and then eat sugar all day. Do not drink cinnamon tea at night and then have cookies with it. Do not drink turmeric tea and ignore an open wound. Do not drink ginger tea and keep skipping your blood sugar checks. Do not drink chamomile tea and keep walking barefoot with numb feet. The tea is support. The pattern is the treatment environment. If your feet burn, tingle, go numb, itch, or develop marks, you need to think in 3 layers. First, blood sugar control. Second, circulation and inflammation. Third, direct foot protection. That means monitoring your blood sugar, taking your medications as prescribed, eating meals that do not spike you all day, moving safely if your doctor allows it, wearing proper shoes, checking your feet every night, and getting medical care quickly for wounds or color changes. Let me give you a simple plan. In the morning, replace a sugary drink with green tea. After lunch or dinner, use ginger tea if you feel heavy, cold, or sluggish. When sweet cravings hit, use cinnamon tea instead of dessert drinks. In the evening, use turmeric tea a few times a week if it fits your medications and health conditions. Before bed, use chamomile tea and inspect your feet. That is not complicated. It is not expensive. It is not a miracle. It is a daily signal to your body that you are no longer ignoring the problem. And here is what I want you to remember most. Burning feet in diabetes are not something to laugh off. Numb toes are not normal aging. Tingling like needles is not just a small inconvenience. These are signals. Your nerves are speaking. Your circulation may be struggling. Your blood sugar may be leaving clues. The worst thing you can do is wait until you cannot feel your feet properly, or until a small wound becomes a serious infection. So start today. Choose 1 tea from this list. Replace 1 sugary drink. Check your feet tonight. Look between the toes. Look at the heels. Look at the soles. And if you see a wound, black mark, swelling, redness, pus, or anything that worries you, call your doctor. If this video helped you understand what your feet may be telling you, like this video, subscribe to Dr. Arthur Mark, and share it with someone who has diabetes and keeps saying their feet burn at night. Sometimes sharing one simple explanation can help someone take action before a small warning becomes a serious problem. And remember, your feet are not separate from your blood sugar. They are often one of the first places your body shows the damage. Protect your sugar, protect your nerves, protect your feet. Start with 1 better drink, 1 better habit, and 1 better decision today.